Question number 1. A patient with increased intracranial pressure should be positioned at Trendelenburg, flat supine, head elevated 30 degree, prone. The right answer is option C. Next one. A patient develops stridor immediately after thyroidectomy. The nurse should suspect hypoglycemia, air obstruction, hyperkalemia, pulmonary embolism. The right answer is option B, airway obstruction. Next question. The earliest sign of hypoxia is cyanosis, bradycardia, restlessness, unconsciousness. The right answer is option C, restlessness. Next one. In nephrotic syndrome, the characteristic finding is hematuria, massive proteinuria, glycosuria, or pyuria. The right answer is option B, massive proteinuria. Next question. In which cranial nerve is tested by the gag reflex? Cranial nerve 3rd and 4th, cranial nerve 9 and 10, cranial nerve 7 and 8, cranial nerve 11 and 12. The right answer is option B. Next question. The antidote for opioid overdose is atropine, flumazenil, naloxone, protamine sulfate. The right answer is option C, naloxone. Next question. During blood transfusion, the nurse should first monitor the patient after 5 minutes, 15 minutes, 30 minutes, or 1 hour. The right answer is option B. Next question. Which fetal heart rate indicates fetal distress? 120, 140, 170, or 130 beats per minute? The right answer is 170 beats per minute. Next question. The most common complication of prolonged immobility is cataract, pressure ulcer, otitis media, glaucoma. The right answer is option B. Next question. A positive Babinski sign in adults indicates normal finding, CNS lesion, liver disease, or renal disease. The right answer is option B, CNS lesion. Next question. Which insulin has the fastest onset of action? Regular insulin, NPH insulin, insulin lispro, glargine insulin. The right answer is option C. The most common site for IM injection in adults is deltoid muscle, ventrogluteal muscle, abdomen, forearm. The right answer is option B. The incubation period of chickenpox is 1 to 3 days, 5 to 7 days, 10 to 21 days, or 30 days. The right answer is option C. Which electrolyte is the major intracellular cation? Sodium, potassium, calcium, magnesium. The right answer is potassium. The five rights are related to surgery, medication administration, nutrition, or CPR. The right answer is medication administration. Next question. WHO headquarters is located in New York, Geneva, Paris, or London. The right answer is Geneva. The primary aim of immunization is treatment, prevention, diagnosis, or rehabilitation. The right answer is prevention. The slogan Health for All is associated with Alma Ata Declaration, WHO Day, UNICEF, Red Cross. The right answer is option A. ASHA workers works under NHM, WHO, UNICEF, ICMR. The right answer is NHM, National Health Mission. Next question. Negative symptom of schizophrenia is delusion, hallucination, anhedonia, agitation. The right answer is anhedonia, option C. Lithium is used to treat depression, bipolar disorder, schizophrenia, dementia. The right answer is option B, bipolar disorder. Next question. The fundal height at 20 weeks corresponds to symphysis pubis, umbilicus, syphis sternum, pelvis. The right answer is option B, umbilicus. The magnesium sulfate toxicity is indicated by hypertension, absent deep tendon reflexes, fever, tachycardia. The right answer is option B, absent deep tendon reflexes. Next question. Partograph is used to monitor placenta, labor progress, fetal anomalies, and PPH. The right answer is option B, labor process. Next question. The most common symptom of left-sided heart failure is constipation, dyspnea, diarrhea, jaundice. The right answer is option B, dyspnea. A patient with renal failure should avoid potassium-rich foods, rice, chapati, watermelon juice. Right answer is option A, potassium-rich foods. Next one, which electrolyte imbalance causes peaked T waves? Hypokalemia, hyperkalemia, hyponatremia, or hypocalcemia. The right answer is option B, hyperkalemia. Myocardial infarction is diagnosed by elevated bilirubin, troponin 1, creatinine, or urea. Right answer is option B. HIV infection commonly causes Candida infection, typhoid, cholera, malaria. Right answer is option A, Candida infection. Moving to the next question. Parkland formula is used for stroke, burns, asthma, MI. Right answer is option B, burns. Next one. Digoxin toxicity is commonly causes polyuria, yellow vision, hypertension, or weight gain. Right answer is option B, yellow vision. The common cause of opportunity infection in HIV patient. Option A, Candida. Option B, E. coli. Option C, Salmonella. Option D, Vibrio. Right answer is option A, Candida. Which acid-base imbalance is expected in a patient with prolonged vomiting? Metabolic acidosis, respiratory acidosis, metabolic alkalosis, respiratory alkalosis. Right answer is option C. The earliest laboratory finding in iron deficiency anemia is low hemoglobin, low serum ferritin, low hematocrit, or low RBC count. The right answer is option B, low serum ferritin. A postpartum woman develops excessive bleeding and a bogey uterus. The priority nursing action is start oxygen, massage the uterine fundus, check blood sugar, elevate the legs. The right answer is option B, massage the uterine fundus. Moving to the next question, a patient receiving heparin has APTT of 90 seconds. The nurse should increase the dose, continue the therapy, hold medication and inform physician, or give vitamin K. The right answer is option C, hold medication and inform physician. Which electrolyte imbalance is most likely to cause muscle weakness and viewers on ECG? Hypokalemia, hypokalemia, hypernatremia, and hypercalcemia. Right answer is hypokalemia. A child with category failure develops a cyanotic spell. The immediate nursing intervention is supine position, Nietzsche's position, Trendelenburg position, or prone position. The right answer is option B, Nietzsche's position. A patient with SIADS is expected to have hyponatremia, hyponatremia, hyperkalemia, hypercalcemia. The right answer is option B, hyponatremia. A patient with meningitis is placed in which type of isolation? Contact, droplet, airborne, or reverse? The right answer is option B, droplet isolation. Which electrolyte abnormality is most commonly associated with chronic renal failure? Hypokalemia, hyperkalemia, hypernatremia, hypercalcemia. Right answer is option B, hyperkalemia. Moving to the next question. Question number 43. A patient develops sudden chest pain, dyspnea, and hemoptysis after surgery. The nurse should suspect pneumonia, pulmonary embolism, pleural effusion, or tuberculosis. Right answer is option B, pulmonary embolism. The next one, the most sensitive indicator of tissue perfusion is blood pressure, pulse rate, urine output, or respiratory rate. Right answer is option C, urine output. A nurse is assessing a patient with left-sided stroke. Which finding is expected? Left-sided paralysis, right-sided paralysis, bilateral paralysis, no motor deficit. The right answer is option B, right-sided paralysis. Which acid-base imbalance is expected in diabetic ketoacidosis? Metabolic alkalosis, respiratory alkalosis, metabolic acidosis, respiratory acidosis. Right answer is option C, metabolic acidosis. Next question. A patient with chest tube drainage suddenly has no drainage. The priority nursing action is remove the tube, assess for tube obstruction or kinking, clamp the tube, increase the suction pressure. The right answer is option B, assess for tube obstruction or kinking. Next one. The first assessment in any emergency situation should follow nursing process, ABC approach, SOAP format, head to toe assessment. Right answer is option B, ABC approach. Next question. A patient develops fever, flank pain, and chills during blood transfusion. This indicates allergic reaction, febrile hemolytic reaction, hyperglycemia, fluid deficit. Right answer is option B, febrile hemolytic reaction. Next one. Which cardiac enzyme rises earliest after myocardial infarction? Troponin 1, CKNB, myoglobin, LDH. The right answer is option C, myoglobin.